below if it is normal. Again, this is very important, breast ultrasound for female and male. You'll be surprised, some male patients will come, they will feel a palpable mass on their, near to their nipple. So we do breast ultrasound both in female and in male patients. Okay? Here is the landmark. The breast would appear as a clot. So in doing the ultrasound, always do it clockwise. Okay? You start from 12 o'clock there, and then go 1, 2, 3, 4, 5, 6. You try to rotate. So this is the upper inner quadrant. This is the lower inner quadrant, upper outer quadrant, and the lower outer quadrant. So the breast, just like the abdomen, is divided into 4 quadrants. Okay? So the most important in doing breast ultrasound is to observe the margins of your lesions. Okay? So there would be different types. This one is stipulated. You have your pictures there. So if it's stipulated, it's more on malignant lesions. Okay? Even the angular, this is more of malignant. If it's circumscribed, this is more of benign. Okay? So, what's important here is this stipulated. High suspicion of malignancy if we see stipulated breast nodules. There you are, circumscribed. This is more of a benign. This one is the most malignant, this stipulated. Okay? So it says here, speculated with radiating lines from the mass is a very suspicious finding. Okay? All I want you to remember is the stipulated and the well circumscribed. Okay? So this is a cystic structure seen on your breast. Okay? The margin is well circumscribed. So this is more of a benign. Even this one, it's a solid, but it's well circumscribed. So most likely, this is fibroadenoma. This one is complex. The black one is more on cystic. The other one is more of solid. Please don't answer. 1/3 is dermoid cyst. Okay? It looks like a dermoid cyst. Okay. So you try to look also at the axillary lymph nodes. So the lymph nodes would appear like this. Okay? It's also very important to note and report the presence of lymph nodes if you do the breast ultrasound. Especially if you see one nodule with stipulated borders. Okay? So, how often you should do your breast examination? What do they suggest? Breast palpation. Diba usually, every menstrual cycle, you do your breast examination. Because most fibroadenoma, the patient would complain of pain during their menstruation. Okay? One of the leading causes of malignancy in female is breast cancer. Okay? And it's very important that you should catch the lesion at its early stage. Although breast CA and colonic CA is one of the well-studied malignancy with favorable outcomes. There are breakthroughs in the management of colonic as well as breast carcinoma. But mind you, for breast CA, once the patient is negative for estrogen, progesterone receptors, and positive for Herceptin, that is very, very costly. Usually for the Herceptin, that would be 18 cycles. Okay? And the list is you would be needing 3 vials per session. Except for the initial dose, that would be plus 1 vial. And 1 vial of Herceptin now costs you something like 40 to 42,000. So, if you're going to have the 18 cycles, you'll be needing something like 55 vials. So that will be more than 2 million. So even though it's a breakthrough with all these medicines, not unless you have the money, you're going to survive. So, you'll do survive malignancy if you have the means. Okay? So, it would be best to catch the lesion at its early stage. So, I would prefer breast ultrasound rather than mammography. Okay? And breast ultrasound is more convenient procedure as compared to your mammography. Most Filipino females would feel very uncomfortable doing the mammography. Anyone who had undergone mammography here? Wala pa. That's good. So, I think this is the last topic, the testis. So, what's important here is to get the longitudinal and the transverse measurement for the testis. Okay? So, again, that's a picture of your normal testis. So, this is a testicular mass. You try to see the normal picture as if you're looking at the liver or the spleen. It's homogeneous, and then all of a sudden there's this more intense structure here, so that is a testicular mass. Okay? And the most common abnormal findings, it's not a cyst in the testis would be the presence of fluid. That is your hypocyst. So this is your testicular cyst. This is your hypocyst. It looks like pleural effusion or ascites. So in your patient, in pediatric cases, could not afford an ultrasound, instead of doing ultrasound, what examination would you do to establish the presence of hydrocele? Transillumination. Okay? So usually the mother who would tell the doctor, Doc, napansin ko, lumaki bigla yung scrotum ng baby. So you would do transillumination. Okay? The positive for transillumination would be who did transillumination examination here? Meron na? Sa baby, usually. Makikita mo yung light, yung shadow ng light lalabas. Yung red, lalabas siya, ma-appreciate mo siya. Whereas kung walang fluid yun, wala. Hindi siya mag-brighten dun sa kabilang side. Because you have the water that would be your medium na penetrate yung light mo. Once you don't have fluid in the scrotum, wala. Yung light doon lang sa skin, hindi siya magpapas through. Magpapas through yung light is because mag-scatter siya once na it passes through the water. This is massive hydrocele. Okay, the last would be the thyroid. So, this is an important landmark for your thyroid. This is your trachea. So, this is the left lobe. This is the right lobe. Again, try to view the film as if your patient is facing you. Okay? So, the structure that connects the right lobe and the left lobe would be your isthmus. Okay? That's still a part of your thyroid. There you are, a clear picture of your isthmus. So this is your trachea, this is your right lobe, this is your left lobe. So what structure is this? That is your carotid artery. This is the right carotid, this is the left carotid. Okay? Once you try to see and evaluate the picture, it looks homogeneous. And then once you saw something that makes the structure inhomogeneous, then describe the lesion. So this is a normal picture, longitudinal picture of your thyroid. There you have a solid mass. So there would only be three lesions in your thyroid: solid, cystic, and complex. There you are. That's the trachea. That's the lesion. It's on the left. So, study. The important landmark here is the trachea and the thyroid, isthmus, okay? Definitely, thyroid nodules will come out. Nodule if it's below 3 cm, mass if it's more than 3 cm. There you are. This is a cystic structure. This is a solid. This is a cystic with microcalcification. So again, your landmark here is your trachea, and above your trachea is your isthmus. Okay? In some, we do the Doppler study just to see the vascular structures within the lesion. Okay? So this is a solid, this is a cystic with microcalcification. This is a complex, more of cystic. Okay? So if we do the Doppler study, you see the vascular structure could be appreciated on the solid component. Okay? Never expect vascular structure in cystic lesion. So this is ascites, this is your gallbladder, this is your liver, and that is the fluid seen on the above the liver. This is your gallbladder. So ascites. Okay. Again, more of ascites in the liver appears cirrhotic. Okay, it's nodular and small. So if you try to get the history of the patient, most likely the patient is alcohol. Those are small bowels, bowel loops. So floating. Mas dense ang water, kaya yung intestines filled with air would rise and float. Okay? This is your ascites on the splenorenal. This is your spleen, this is your left kidney. Here you are, finger-like structures. These are your small bowel loops, and that's the fluid. So, management for ascites, that would be paracentesis. Okay? This would be pleural effusion. You can only appreciate fluids in the lungs in ultrasound. Okay? Without fluid, you can never appreciate the lung. So fluid is very important window for you to appreciate the lungs. Okay? So again, if I'm going to ask you the management for this would be thoracentesis. Okay? So that is your liver, that is your diaphragm. There you have moderate amount of fluid on the right lung. This one, a better, clearer picture. The liver is well visualized, and then you have the diaphragm, and then you have massive pleural effusion above. This one, a clearer picture of your spleen. The whole organ is visualized as compared to your liver. This is just the right lobe of the liver. In here, you have the left lobe. So, this is pleural effusion on the right. Whereas this one, you have a full view of your spleen. The whole structure is well visualized. This is the diaphragm and this is the fluid. So, massive pleural effusion on the left. The lung mark is very important, as I've said before, because in doing the thoracentesis, you have to do it on the correct side, on the affected side. Okay? Unlike in doing the X-ray, even the presence of moderate or massive amount of pleural effusion on the right, you could do the reverse. Okay? Kahit hindi siya, kunwari right, pleural effusion, moderate to massive in amount. Diba? Usually, sinabi ko sa inyo, you have to do the right lateral decubitus to establish your diagnosis of pleural effusion. You can also request for left lateral decubitus. Kasi, pag bababa siyang gano'n, mag-clear yung taas ng right lung, bababa yung fluid. So, you would appreciate the fluid just above your cardiac silhouette. Okay? So I think this is the last slide.